Today I'm going to give a brief explanation about what is chronic rhinosinusitis and what's the treatment of this disease. Chronic rhinosinusitis is the inflammation of nasal and paranasal mucosa. This inflammation, if still persists after 12 weeks, we then call this disease as chronic CRS. The patients with CRS generally admit to the outpatient departments with the complaints of nasal obstruction, nasal stiffness, nasal discharge, which is generally mucoid or purulent, and also olfactory loss is another important finding of this disease. If we don't give adequate treatment to chronic CRS, the disease persists and progresses to complications. In that case, the patient may have visual loss, diplopia, which is double vision, or if the infection spreads to the central nervous system, then meningitis or central nervous system abscesses may be seen. The diagnosis of CRS can be made first by the symptoms of the patients, but only the symptoms is not enough to make a definite diagnosis. So we do perform endoscopic nasal examination and examine the mucosal inflammation or the presence of any polyps or purulent discharge from the sinuses. Besides this examination, we also ask for CT of the paranasal sinus to put a correct diagnosis. The primary goal of the treatment in CRS patients is the eradication of the infection. To get this aim, to achieve this aim, we generally prescribe the patients antibiotics and topical sprays through the nose. Who are refractory to the medical treatment and their symptoms persist, we do perform endoscopic sinus surgery. This surgery is performed by telescopes which are put through the nostrils and without any skin incision outside. And by this surgery we can reach to the sinus cavities and clean all the debris, infection and the polyps inside the nasal cavity.